Hello and welcome to Ask the. I'm your host, Shelley Irwin, and of course tonight we are talking on the topic of optometry. So call in with those questions and comments, get that free advice. Numbers will be at the bottom of the screen. Joining us tonight are Dr. Gary Anderson. Dr. Anderson, good evening to you. And
good evening.
Dr. Patrick Holzer, glad you are back as well. Ask the optometrist. How do optometrists spend their days, Dr. Holzer?
Well, we do primary eye care. Optometrists are the primary eye care providers. So we do eye health examinations. We also do refractions or vision tests for glasses, and we're the primary fitters of contact lenses. So do lots of contact lens exams. Primary eye care, for eye health things, we see patients who are diabetic to screen for any problems there. People with conditions like macular degeneration, also glaucoma. So we're kind of the primary eye care providers, and the ophthalmologists are the ones who do surgery. So if we find the need that they ever need surgery, we can send them along to the ophthalmologist for those type of things.
Dr. Anderson, where does the optician come in to play?
The optician is the optical expert. We've had training in that also, but the optician is the person who manufactures the glasses, makes them, measures the bifocal heights, the different measurements that are needed, adjusts the glasses, measures them when they come in to make sure the prescription fits. So he's the optical engineer.
Yes.
He or she.
Thank you. What is involved in a standard eye examination? We'll start with you.
Thorough case history of the patient, their health history, their visual problems if they're having any, what they do with their eyes. We all do different things. Some of the activities that they use. Are they at the computer all day long? Are they out driving a truck? Their recreational activities. So really how they use their eyes tells us a lot when we go to prescribe the final prescription for them, whether we're giving them glasses or contact lenses or a combination of both. Then an evaluation of the visual system, how their eyes work, the refractive error, what it takes to focus their eyes, and like Dr. Holzer said, then the eye health. We can tell more than just the health of the eye. We can often tell a lot of the health of the body, high blood pressure, diabetes. Many conditions can show up in the eye before they really show up in other parts because we're actually looking at the blood vessels as the blood flows through the blood vessels.
Yeah. At what point, I think even at birth, one checks eyesight?
Oh yeah, it's recommended by the American Optometric Association to have kids have their first assessment or vision exam and eye health exam during the first year of life. And then if no problems are found, then, again at preschool, and then, again right before they start kindergarten. If there's any problems or concerns, we can, treat them accordingly. One of the big things we're looking for with young kids is something called amblyopia or lazy eye. Mm-hmm. If that's caught early, then we can prevent any permanent vision loss. If we don't catch that early, kids, their vision cannot develop as strong in one eye versus the other, and it takes a lot longer to correct that once they're through their critical period of development. We're not born with perfect vision. Our brain actually develops a connection to those eyes, and it might develop a stronger connection to one eye if it sees better versus the other eye if it doesn't see quite as well for whatever reason. We've seen, you probably have seen some kids who have an eye that turns in or turns out. That can be one reason, but also if there's a large prescription in that eye that's not corrected, we can catch that early and get the right correction on the child and really help them out throughout the rest of their life.
What is it that causes nearsighted? Why did I need glasses at age 12?
Heredity is a large part of it. Your family history and your environment. Our eyes are a result of both of those. So doing a lot of reading. In countries that are more literate, we have more nearsighted people. The muscles in the eye have to focus, the ciliary muscles. And when you're doing a lot of reading and not looking up often enough to relax, those muscles stay contracted a little and the progression of nearsightedness accelerates. And also the physical size of the eye. A bigger eye tends to be nearsighted because it has a longer axis. So heredity and environment.
Farsightedness then?
Same reason, but the opposite. It tends to be a smaller eye. And we go to other countries to do mission trips. We see more farsighted people. They don't do as much close work, as much reading. So it's more a result of heredity.
Dr. Holzer, how are we doing on the fight against macular degeneration?
Well, good. There's actually a lot going on in that area as far as treatments right now. Macular degeneration is one of those tough things. It's an aging change, usually later on in life, 5-10 years ago we didn't have treatments for it. Now we can gain some of the vision back that's been lost. There's lots and lots of research, especially in the nutrition area. We think that some nutrition deficiencies could be some of the causes of that. But one of the big things that we can do nowadays is, for folks, younger, is to wear sunglasses or UV protection. We think that's also a contributing factor. So if you wear that now, that's going to block out some of those harmful UV rays so we don't accumulate as much over our lifetimes.
What does one look for in a pair of sunglasses?
UV absorption. Style doesn't have any effect on what the lens absorbs, but ultraviolet A and B. A polarized lens doesn't make it any healthier for your eye, but it can take the glare away, so a little less squinting, a little more comfortable. But ultraviolet absorption is the most important.
Also, some sunglasses that might wrap around on the sides because we get a lot of light from the back and the sides and that kind of thing. Also, adding a hat, that'll block out from above, and that helps quite a bit too. Yeah.
Glaucoma, what's up here?
Glaucoma, that's a condition where the optic nerve is damaged over time, we have a lot more technology these days to catch it earlier. To screen, we screen for it during our exams, probably 2 or 3 different ways. And there's new technology out, that can pick it up even sooner, so we can treat those folks before, the devastating vision loss occurs later on in the process.
Is that still the poof in the eye upon an eye exam? Is that still how you determine the glaucoma state?
That is a test, but most of us use other instruments that are more accurate. That's a good screening device, but when it comes down to really accurate testing, there's much more accurate devices to test for that, and like PJ said, some devices that can really detect glaucoma earlier than we've ever been able to detect before. Because once the nerve damage is done, you're not getting it back. And so it's not like walking around without glasses on and seeing blurry and then all of a sudden getting some glasses. When you've had glaucoma and you've had nerve damage done, that vision will not be coming back. It's permanent loss.
What parts of the eye are available for transplanting? Can we get into this?
Cornea is the main tissue. The cornea, which is the front of the eye, the front lens, and it is avascular, meaning there's no blood vessels in it. So it's a little tougher to transplant compared to say some skin, but it is what when somebody passes away and they've donated their tissue, the eye is used. That is the part of the eye that is used, the cornea. The whole eye can be used in terms of research, so it's very valuable for those that would put on a driver's license that they want to donate tissue, because right now we still don't have a synthetic cornea available. They're working on that, but we don't have that. So if somebody has a scarred cornea or another disease that they can't see through, a cloudy cornea, their only option is a transplant from a donor.
Well, we have a caller on the line. Hi, caller. Which question, please?
I have a question about contacts. What contact is best for astigmatism?
Contact lenses, PJ.
There's, as far as astigmatism, correcting contact lenses. Astigmatism means that the eye is not perfectly round in shape. It's a little more oval in shape. If we use, a comparison, a perfectly round eye would be shaped like a basketball, and somebody with an astigmatism would have an eye that's shaped more like a football. So we use different contact lenses that have a different curvature this way versus that way in the lens. And those are called toric contact lenses. There's also some great lenses called gas permeable lenses. They're a little bit more rigid that correct for a lot of astigmatism as well. People who wear those tend to appreciate, they think the vision's a little sharper with those as well.
Great. I have another question from you, caller. What's your question, please? Thanks.
Hey there. Excuse me. Hi. What would be the determining factor between going from glasses to LASIK?
Gosh, it's very individual, and it depends on the patient and your desire. If you're wearing glasses full time and you're tired of wearing glasses, and especially if you've had difficulty wearing contact lenses, you're very motivated to not have your glasses on. So once you have an evaluation, there's determining factors, whether your cornea, the front of the eye, is thick enough, and the shape of the cornea, how curved it is, or how flat or non-curved it is. Dr. Holzer has a lot of experience doing LASIK pre-op, so he can add to that.
Yeah. Yeah, LASIK, the biggest thing is to make sure you're a good candidate, whether it's, you know, if you have dry eyes, that might, you know, limit your candidacy for LASIK surgery. Whether, you know, the prescription is too high, you know, we can only treat so much. The laser's only approved for so much. So, you know, the prescription strength is another thing. Also, patient expectations. You're still going to need some glasses part of the time, whether it's for driving or nighttime, something like that. Or if you get over that, you know, into that reading glasses age, you're still going to need something for the up-close stuff.
You bet. It's better than the alternative. Going to take a break, show you what's coming up next week. Right now, it's Ask the Optometrist. Stay with us.